Supporters of a bill in the Oregon legislature want to ensure equal pay for healthcare providers performing the same work.
That bill specifically helps nurse practitioners and physician's assistants. Newswatch 12 Steven Sandberg is live in the Medford newsroom and says those workers are often being paid a lower rate.
A nurse practitioner I spoke with said it's becoming more common for him to provide the same primary care as a doctor, and he wants people in his position to be paid equally by insurance companies.
They do the same services, they bill under the same codes, so therefore the reimbursement should be the same.
Jason Jex works as a nurse practitioner at Valley Immediate Care and gives patients a number of health services.
Much like a physician does, assess them, do a physical assessment, and then we prescribe medications.
But he says he's not paid the same by insurance companies.
The patient's still paying the same, but then they're reimbursing nurse practitioners and PAs at a lower level.
So he's sent 2 letters of support for an Oregon House bill that would require insurance companies reimburse nurse practitioners and physician's assistants for the same services performed as doctors.
That's kind of what the nurse practitioners are here for. We want to fill that void and do primary care.
But State Senator Alan Bates, who's also a doctor, says there are some key differences.
I have 2 nurse practitioners that work with me. They are superb practitioners, do a wonderful job with patients, but probably consult with me 3, 4, 5 times a day on particularly difficult cases.
He says he's in favor of parity for nurse practitioners working alongside doctors or for NPs in rural areas where there are fewer doctors.
We really want to bring people, nurse practitioners and PAs, into the area we need them the most, which is primary preventative care. This is actually something that started out last session, and I was opposed to it then. This bill is much closer to something I can support, but needs some changes in it before I could support it.
The bill passed the Oregon House with a 39-20 vote. It's now going to the Oregon Senate. Live in the Medford newsroom, Steven Sandberg, Newswatch 12.